Now, did you know what is the normal blood pressure? So, normal blood pressure is the one which is the blood pressure of systolic BP of less than 120 and diastolic BP of less than 80. So, anything less than 120 by 80 is you are in the normal range. You need not worry. But you need to check regularly as the age goes as our dietary changes occurs, and when we are doing less exercise, these are all going to trend to increase the blood pressure and make us a risk factor for stroke, that is brain attack or heart attack, and even the target organ damages can occur. So now we know the normal BP. So what are the other stages of blood pressure? So we need to know you are in which stage of blood pressure and how much risk is there for stroke or any heart attack. So next comes the elevated blood pressure. So when we can tell elevated blood pressure, a blood pressure of between systolic of 120 to 129 and diastolic still it can be less than 80. So isolated systolic blood pressure elevated is also a stage of elevated blood pressure. Now what is high BP? So high BP, so the doctor will tell you are having high BP, so you should be careful. So what do you mean by high BP? So high BP is again divided into two stages, the stage 1 and stage 2. Stage 1 is the stage between 130 to 139. Systolic is stage 1, and along with diastolic BP of 80 to 89 is again stage 1 high blood pressure. Now comes the stage 2 high blood pressure. So stage 2 high blood pressure is the blood pressure of more than 140 and diastolic of more than 90. So anything blood pressure of more than 140 and more than 90 is a stage 2 high blood pressure. Now what is hypertensive crisis? So you comes to a stage of hypertensive crisis, that is BP is very much high. So systolic BP of more than 180 and diastolic of more than 120, it is called as hypertensive crisis. So one should know their BP range so that they know how much they need to take precautions, they need to adjust their diets, they need to do more exercise, they should avoid sedentary lifestyle. Hence future there is less chance of developing stroke in their life, and they also need to check the blood pressure of their near ones and close relatives, and they need to communicate to this all the public so that we can prevent stroke in the future. By controlling the blood pressure, we can control the stroke. Thank you.